The risk of having a heart attack over Christmas is nearly 40% higher than every other day of the year. New Year's isn't far behind. And so if you look at the trend over the course of a year, there are these two spikes. And the question is, why does this happen? There are a lot of different causes. The way I think about it is, how do the holidays increase the stress on our mind, on our body, and how does it throw off our behavior that might lead to increased risk of heart attack? When we think about the stress effects of holidays on the mind, it isn't hard to imagine. You've got this family gathering. It could be stressful. It could be emotional. There could be conflict. There could be political arguments. And so whenever anger arises, hostility, frustration, it can have, and we know it has, a negative effect on your heart's health. And it can even raise your blood pressure and constrict your blood vessels. So that's number one, is the stress. On the flip side of that, there are a lot of people who are alone during the holiday season. Some of us can be with others and still feel alone. We may have lost a loved one during the holiday, and that can come back into our mind and our heart. And believe it or not, that can increase our risk of having a broken heart or heart events. So that's just one cause, is the mind. When we look at effects on the body, think about Thanksgiving, but really think about the Christmas meal, New Year's, other holidays. We tend to eat more fattier foods, saltier foods. Guess what else we do? We drink more alcohol. All of these things together increase the risk that our body will develop problems like heart attack, abnormal heart rhythms, congestive heart failure, which is why we see a nearly 40% increased risk of heart attacks over the holidays, and an actual close to 5% over the whole holiday season, an increased risk of dying. So that's the mind. We talked about the body. What about behavior? Well, some people with heart disease, they're traveling over the holidays, there's stress, they may forget to take their medications. So then what happens? Blood pressure goes up, cholesterol goes up, etc. Other people with diabetes may not be checking their sugar, or people may not be checking their blood pressure. So it's really vitally important to remember to take those medications, to remember to check your numbers, your sugar, your blood pressure. And then we can talk about ways to reduce all those stresses, but holidays increase stress on the mind, the body, and behavior. And what else is happening this holiday? We've got COVID, we've got the cold weather. Cold weather itself can constrict your blood vessels, increase risk of heart disease and other causes of illness. And then we have COVID and increased risks of flu and other viruses. Well, when we have respiratory infections, it increases the stress on the heart and the risk of heart attack and even cardiac death. So all of these different factors are coming to a perfect storm during the holiday season. The good news is there are a lot of things we can do to protect ourselves from that increased risk of heart disease during the holidays. The first thing has to do with prevention. Remind your grandma to bring her medicines to the holiday meal or the weekend. Remind them to bring that blood pressure cup. Remind them that there's a low salt option, or even everybody gets on board and we say, we're going to have a healthy holiday this season. We're going to substitute a few of those fatty favorites with maybe something with more vegetables, more whole grains. We're going to cut down on the alcohol just a little bit. We're going to watch out for any other unhealthy habits. And we may even around the holiday time say, hey guys, let's go for a walk or bundle up and do something active. I know it's cold outside. All of these things reverse those risks that we talked about. So that's on the prevention side. And there's one other piece that's critically important that we need to get the message out there. You who's watching now can save a life only if you know the signs of a heart attack and what to do in that moment. And believe it or not, only 50% of people know the signs of a heart attack. We can all educate ourselves right now with this information. There are actually 5 signs of a heart attack that everybody needs to know about. Number 1, that chest pain, that typical elephant on the chest that can affect men, women, just the same with a heart attack. Number 2, someone gets short of breath. So grandpa gets short of breath at the table, or he starts sweating. That's another sign of a possible heart attack. Number 3, somebody starts getting really dizzy and lightheaded and they're about to pass out or they even pass out. That can be a sign of a heart attack. And there are 2 more signs that people don't always think about. 1, along with that pain in the chest, we can also get a pain in the jaw or neck going up here. So if somebody's saying, I'm having this bad pain coming up here, start to think, wait a second, doesn't so-and-so have a risk for heart disease? And on that note, we don't always have a warning that someone's going to have it. About 1 out of every 5 people at the Christmas table, New Year's Eve party has no risk for heart attack, and they still can develop one. That's why we need to also think about that 5th sign, which is a pain down the arm. So number 1, chest pain. Number 2, shortness of breath. Number 3 is sudden severe dizziness. Number 4 is pain up into the neck and jaw. And number 5 is pain down the arm. If you remember those 5 signs and you see somebody at the holiday meal having any one of those, stop what you're doing, call 911, and be prepared. If you notice that somebody's having any one of those signs and they pass out, make sure to know CPR. You could even make it a preparation for the holiday, just like getting your COVID vaccine and making sure you're taking all the COVID precautions. Make sure you know CPR because you can save a life if you act quickly. CPR is much easier these days for the average person. You don't have to pull out a mask or blow on someone's mouth. It's called hands-only CPR, and this can be very effective. All you need to remember is if somebody's totally passed out and they have all the signs of heart attack, call for a defibrillator if there is one. And if there's not, you place 2 hands on the chest and you do a compression about 2 inches, 100 to 120 beats a minute while paramedics are coming. Learn CPR and learn the signs of a heart attack. We all tend to think that we're safe and we're totally immune from these things. We're going to go have a good time at the holidays. It's not going to affect us. It's somebody else. Well, as a doctor in the hospital, we see people coming in all the time over the holidays who did not expect to have a heart attack or a heart condition. And the saddest thing that we see is when somebody had the signs but they ignored them because they wanted to keep on with the party. They were maybe closed up last year with COVID, and they were so excited that they had that chest pain, they had that trouble breathing, but they didn't tell anybody. So I would emphasize, don't put it off. Make sure you call for help. There's a couple of other pieces here. The emotional stress over the holidays affects all of us, and there are things that you can do to protect yourself from that. Number one is know those situations where you get triggered. Know which relative in the family where when you're near them, the blood starts to boil a little bit, and give yourself permission to keep a little distance there. Number two, give yourself permission to just take a break. If you feel like you're starting to get stressed out, you don't like the crowd, just give a little break, say, I'm going to go take a little bit of fresh air. Number three is use some of your relaxation techniques. When that stress goes up over the holidays, during the day, you want to take moments. You can go and take a little walk in nature, listen to some music, take some nice deep breaths in and out, even stretch or relax your body. And if you want to go for extra credit, you can do a little practice mindfulness meditation, which is proven to reduce that emotional stress over the holidays. Those are some things you can do. While we're working on the stress reduction, the other good news is that when you kindle that warm, loving, nurturing feeling in your heart, not only does it feel good, but you can reduce that increased risk from the holidays causing heart attack, because feeling grateful and doing acts of kindness has been shown to reduce your chances of having heart attack or even dying from heart disease. Not only does it feel good, but it helps you too.